Hi, I'm Timothy Lewis with Encompass Health, and here in Murrieta, California, we provide 3 hours of physical therapy, occupational therapy, and speech therapy to patients here who have a decline in function and also who need medical oversight from our medical director, Dr. Hanrahan, and also exceptional nursing care from our nursing staff here. So the type of patients that we see is a wide range. It all depends on the patients basically have to have a decline in function and medical necessities. So that can be a patient suffering from a UTI with altered mental status, or a patient that has been injured in a car accident with multiple fractures and multiple wounds. And so we can manage a wide range of patients and different diagnoses. When it comes down to having that decline in function and that medical necessity, it can be anything from patients who suffered a stroke, patients with Parkinson's, patients that may have COPD or CHF exacerbations. So when I literally mean a wide range, even patients that have frequent falls from poor balance. So we can take a wide range of patients. So the company has actually been around since 1984, and it started as Health South, and within the last couple of years, I believe around in 2018, we basically took on the name of Encompass Health, which was our home health and hospice company that they acquired in the early 2000s, and they just wanted one name for the whole company versus having two separate names for one entity. For this particular area in Murrieta, we're the only inpatient rehab hospital. And so we basically strive to be exceptional as far as delivering nursing care, as far as delivering physician care as well. And our whole entire goal is delivering patients back to the home setting and basically trying to improve their overall quality of life. And so we try to create a continuum of care process. We just don't discharge patients to the home. We definitely want to connect them with home health systems and continue following up to make sure they can stay as healthy as possible for as long as possible. So the services that we provide when patients come in, they'll basically be seen within 24 hours from our physical therapy team. And so they have access to case management, to respiratory care, to speech therapy. We also can do labs for our patients here in-house, and also radiology. So we can do a wide range of services for patients just coming to this particular hospital. In this area, as I said, we're the only inpatient rehab, and so patients have had the only two options of going to the LTAC, and if they're not sick enough, they won't qualify, or going to a skilled nursing or a nursing home. And if you're a 55-year-old and you're active, involved in a car accident, I highly doubt you want to go to a nursing home. And so, if you're an extremely active older person, that 3 hours a day of therapy that you'll be receiving here will help get patients back to that functional level that they may have been prior to the accident. And so that's the reason why we picked this particular location to provide a new service that hasn't been here. In Murrieta as a whole, it seems like we have a solid hospital system here and also a growing population. And so it's definitely a lot of opportunity for medical professions. I think as this area grows, the need for more physicians, more nursing, and more auxiliary staff will be needed. So it's always a good place to kind of look into, just because of the sheer growth of the community.